Welcome to DBL. We got Dr. Coley in the studio with us today. Hello. Thank you for joining us because, listen, a lot of our viewers have questions because we're going to begin today with Celine Dion. Her sister is giving us a health update saying that she's lost control of her muscles. Now, if you recall, last December, Celine revealed she was diagnosed with a rare neurological disorder known as stiff person syndrome. Celine was last seen in public about a month ago meeting the Montreal Canadiens head coach with her two sons. So, again, to help us understand what exactly this means, we've got our very own Dr. Coley joining us. Thank you again for being here.
Yeah, obviously this is very tragic news. A lot of us are disappointed as fans and sad for her. So what does it mean that she's lost control of her muscles?
Stiff person syndrome is a terrible diagnosis. I mean, thankfully, it's very rare, 1 in a million, essentially. And what it does is it puts your muscles kind of stuck in the on position. So if you think about your muscle, it's soft, right? When you contract it, it gets hard or stiff. So it's basically like a contraction or a spasm of the muscle because the regulation of the muscle sort of goes away. So it starts kind of in the middle ages, 40s to 60s. Women get it more than men. And basically, it starts in the torso muscles and in the limb muscles. But there's also data that can involve the vocal cords, which you can imagine for someone like Celine would be really sort of tragic. And what can happen is it comes and goes, but it's progressive. Right. So eventually you start to lose sort of control of the muscles in the sense that they get stuck in that on position, you get stiff.
There's no treatment at all?
There's no treatment, there's no cure. You can treat the symptoms with like anti-spasm medications and such, but the underlying process, which is an autoimmune, your immune system is attacking the regulation of your muscles is really the problem.
It sadly kind of reminds me of Muhammad Ali, like really losing his ability to speak, and this person that was known for galvanizing the world with what he said. So, you know, Doc, you're talking about the symptoms, but is this going to affect her life expectancy or just her overall life quality?
You know, both, Al. Unfortunately, the diagnosis itself doesn't affect life expectancy, but because it's a chronic progressive condition, the complications of the diagnosis certainly can affect it. And for someone like her, because she has to perform on stage, it can even cause mental health problems like anxiety and depression, because the same regulation that regulates your muscles also regulates our emotions. So having that gone can certainly make that worse. And these muscle spasms can get triggered by loud noises, such as during a concert, any kind of emotional distress or trauma. So I don't know where in the course of her illness she is, but I'm concerned. And I love Celine. I grew up listening to Celine. And so to me, it's just such a tragic thing. And I do hope that we can work to find at least some treatment to slow down the progression of her condition.
Wow, that sounds terrible. Is it kind of like a cramp? That's what I'm picturing. Is it painful?
It's a very painful spasm. So painful, Jeff, that you can actually fall over. And it can affect your posture because you can imagine muscles when they're soft are longer. When they contract, they get shorter. So you can get hunched over and you can have trouble with walking. And it can really, really be very, very challenging.
Well, hopefully, I don't know. You said it progresses, but hopefully not too badly. Let's get to Matthew Perry because it came out last week that his death was caused by the acute effects of ketamine and also drowning. So one, what is ketamine? And I'm imagining that participated in his drowning.
Yeah, so ketamine is an anesthetic. It's been around since the 1970s to give people general anesthesia. We use it in the battlefields. Ambulances all have it. You know, if somebody needs to have a breathing tube put in or something, it basically puts you to sleep, but it allows your heart and your breathing to sort of continue. So in Matthew Perry's case, we knew that he was on ketamine for his depression as well as possibly his addiction, but he didn't receive that medical ketamine. He received that a week ago. So what was found in his system was probably something that he got a hold of himself, probably from a compounded pharmacy. Now, it's a controlled substance, so patients shouldn't just be able to get it without a doctor's help or prescription, so to speak. But it could have made him, basically put him to sleep, and then he could have slipped into the tub and drowned, and he has some heart disease as well. So putting all those things together, he just wasn't awake enough to essentially save himself.
I mean, this is really interesting to me because I lived in Miami in the early 2000s, and this was a very popular rave club drug. So like to see it start to be used medically, I was like, it's great that we're finding a use for it. So please explain to me and to everybody, how is this used medically? And after what happened to Mr. Perry, unfortunately, as a physician, does this affect how you feel about it?
You know, vitamin K, it used to be called, Al, because it's so, it makes you have these, it sends you on a trip. right? You hallucinate, you have this dissociative out-of-body experience. You kind of float out of your body and see your body as a third person almost, and people really enjoy that. So the good thing there is that it allows us to use it as an anesthetic. The good thing is that we can use it for depression, and the FDA has recently approved it actually for treatment-resistant depression. The bad thing, however, is it can have addictive potential. So if we're using it in individuals who already are prone to addiction or depression or PTSD or mental health issues, and it can be addictive, to me, that's a little bit of a dangerous combination. And that's what Matthew's case really demonstrates to me, is that people start feeling better on it, so they want more and more of it, just like any other drug. That's how we get addicted to drugs. And by using it in a way that allows people to feel better, sometimes they start taking it into their own hands and sort of trying to use it. So I think we need to dial back a little bit how we're using it for psychiatric indications. Now, for anesthesia, we'll keep using it. It's very safe, very difficult actually to overdose on this unless other drugs like alcohol or, in Matthew's case, buprenorphine, which is also an anti-addiction drug, are involved. So it's a great anesthetic, but I think for psychiatric uses, we have to be a little careful, and we have to look at the long-term effects.
Right.
You know, can it make you forget stuff? Will it cause dementia? Those types of questions.
Good to know. Okay, so we're going to switch gears here a little bit. Some people who are on popular weight loss drugs, we've talked a lot about them here with you, Ozempic, Wegovy, the list goes on. Some people want to completely break from them during the holidays so they can enjoy the feast and not, because doesn't it makes you not hungry? It
makes you not hungry,
your
it makes
appetite.
you full faster, yeah.
But is that bad to kind of go back and forth like that?
Cost is also something I've heard. People say they want to put presents under the tree, so they're going to take a break from the expensive drugs. So sometimes we interrupt therapy, like if we're getting surgery and getting anesthesia, we'll actually tell you to stop it. But my concern is just going back and forth and stopping abruptly can actually make you gain weight back more quickly, can cause a rebound phenomena. You're messing with your body, right? Just like, would you stop your blood pressure medicine all of a sudden? What do you think is going to happen to your blood pressure? It's going to shoot way up, right? And then on top of that, when you restart it, you're more likely to have significantly more side effects because you usually dial up the dose, but if you stop, it flushes out of your system, and then you start back at the dose you were on. You're going to jerk your body around.
Consult with your doctor.
That's
Just don't think that you can handle it on your own, right?
Yeah.
Okay, so DBL Nation, go and follow Dr. Coley on social media at Pyle Coley MD. Also, be sure to subscribe to her YouTube page for all the latest science news and headlines. Thank you again,
Doc,
Dr. Coley.
thank you so
we appreciate
much.
you.